Hello, everyone. Welcome again to the second episode of Talk with Doc Series. This afternoon, we will talk about an important and interesting topic known as menopause. And this afternoon, we are here to actually talk about and give to you some tips on how to deal with menopause. I am Dr. Anbel Herrera, a board-certified obstetrician, gynecologist, and a feminine wellness advocate. In my presence is a very important person, Ms. Rochelle Gering. She is an expert on age management that includes menopause, andropause, and a holistic approach to nutrition and fitness. Interesting, her background. She is a clinical director in public health department and women's health, including functional and aesthetic medicine. She owns and runs an integrative health practice in Napa, California. Let us all welcome Rachel Gary.
Hi, thank you. It's a pleasure to be here all the way from America. I actually live now in Malaysia, and I am traveling all around Asia working with wonderful physicians such as Dr. Anbel, training and talking about menopause and working with a system called Termila, which we'll be talking about shortly. So this is my second time in the Philippines. It's a beautiful country, and I'm very privileged to be here today. I think it's very timely that we're talking about menopause, knowing that Mother's Day is coming up this Sunday, and women's issues, common questions, and fears about menopause are all the same all over the world. I've had a practice in Napa where the concerns about women there are the same with concerns of the women here. So we all share this in common, and I'm happy that we can address this live on Facebook today.
Indeed, Rachel. And this is the main purpose of Let's Talk V Series Facebook page. And so moving forward, let us now answer one of the common questions women actually ask. What is menopause? For you viewers out there, menopause is actually a moment in time. Okay? Remember that it is a culmination of a biological process of a woman's cycle wherein there is the absence of menses for more than 6 months to 1 year. And interestingly, before a woman would really reach that culmination point, women can go through a transition phase known as the climacteric. And there are actually 3 phases. First would be perimenopause, so before the full completion or absence of menses. And this can occur 10 to 15 years before the full cessation or the full absence of menses. And these are actually seen in women who are still menstruating and yet experience menopausal symptoms. And moving forward, as the perimenopausal moves forward, it actually reaches that culmination of that biological process into menopause. Women now will go through postmenopausal phase. The postmenopausal phase is actually an overlap of your perimenopausal to about 5 years after menopause. So remember, these is your perimenopausal, menopause, and postmenopausal. However, there are women who actually have what we call induced menopause. These are women who have undergone some form of surgery because of conditions in the uterus or the ovaries, and therefore have surgically made them menopausic, meaning to say there is a removal of the ovaries, a depletion of your estrogen supply, and therefore complete absence of menses. There are, however, women, at least 1% of women, who have undergone premature ovarian failure or early menopause. And at least 1% of women below 35 can experience these. And this could be due to autoimmune disorders like thyroid disorders. And this is not from any surgery. And these are women who also experience some form of menopausal symptoms.
So you're saying, doctor, that if women can start to experience menopausal symptoms in the perimenopausal state, and that can last anywhere from 10 to 15 years to postmenopausal, so maybe a lifespan of at least 20 years,
Yes.
they may be experiencing some of these symptoms varying degree. And so we're going to go through some of the symptoms that are commonly associated with menopause and the menopausal cycle. And then we'll be talking about how we can manage some of these symptoms. So let's start with this term called the menopause dirty dozen. And we're going to talk about some of the 12 most common symptoms associated with menopause. So let me just start here with the first one, hot flashes. Everybody's heard about this, and probably most women have experienced this to some degree. And so again, hot flashes, one of the symptoms from menopause due to the change in hormones, change in mostly your estrogen and your progesterone production.
Okay, let me emphasize at this point that menopause is not a one-time fit-all event for all women, that each woman can actually experience any or even an absence of these symptoms
Exactly.
at any time in their lives. Okay, so there are women who may experience these. There are some women who have no trouble experiencing this at all. Okay,
Absolutely.
so Rachel actually gave the first 30 dozen symptom, and that is hot flashes. Now I will go to chest pain. Why do I say that not all women will experience? Because chest pain may not be exactly a symptom of menopause, but it could be actually taken in as a palpitation or a quickening or a fast heartbeat that could actually trigger and make symptoms of that would lead to more prominent symptoms of menopause, and this is secondary to a depletion of your estrogen. Okay? Remember that estrogen is also protective of the heart, and when there is a decrease in your hormonal supply of estrogen, you may start having symptoms of palpitations.
So another symptom that is oftentimes associated with menopause is fatigue. And maybe you experience fatigue prior to menopause, because lots of times as mothers and wives and working women, fatigue is a kind of a common problem. But I think as we move into those perimenopausal years, fatigue becomes more common. And this could be due to, again, a change in the hormones, but it's not just the reproductive hormones. It has to do with thyroid hormone can drop, so we might experience fatigue. Our adrenals, which are kind of our motor, may be producing less cortisol, less DHEA, and be what we call adrenal fatigue. So that might be an underlying cause of fatigue. So we'll be talking about how to address these in short.
Now, for women out there who are 40 years and above and still are menstruating regularly, the early sign of perimenopausal would be irregular menstrual cycles. Why so? Again, because there is a depletion of your functioning eggs in the ovaries. And when there is a depletion of your functioning eggs, there's a decrease in your estrogen, there's a decline in your estrogen, and because of these, there is an imbalance between your estrogen and your progesterone, resulting in a decrease in your ovulation or no ovulation at all, and therefore can lead to irregular menses because of anovulatory cycles, and therefore can lead to either light menses or heavy to strong menses. Okay?
Okay, another sign or symptom of menopause is sleep disturbances or insomnia. Of course, this could be associated again with the fatigue. But what causes the sleep disturbances or insomnia? Again, Dr. Anbel was saying about the changes in the balance between estrogen and progesterone. Could be one of the underlying causes of sleep disturbances. Sometimes women will get a cortisol, what we call a cortisol surge in the middle of the night, and that has to do with changes in the blood sugar and the changes in the hormones. Cortisol is your wake-up hormone, and it's supposed to wake you up in the morning, but sometimes it wakes you up at 2 o'clock in the morning, right? And it may be almost impossible to get back to sleep. So again, sleep disturbances, insomnia, and these can be addressed with some hormonal balancing, which we'll talk about.
Now, for you women out there experiencing some form of forgetfulness, sometimes you don't know where you've put your eyeglasses or even your cell phone. And for women who are forgetful, well, there is a reason for that. There is a decrease in your concentration and sometimes experience some form of memory loss. This is because there are estrogen receptors in the brain. And when there is a depletion in your estrogen levels, these receptors in the brain are also not stimulated. And therefore, there is a disruption in your focus or in your concentration, leading to memory loss and sometimes anxiety and forgetfulness that actually leads to a decrease in your concentration and focus.
Okay, so night sweats. Anybody experience night sweats out there? Again, this has to do with changes in the hormones and the changes in the balance of hormones. So we get the body's trying to regulate itself, and women experience these night sweats, which will cause them to throw off the covers at night and turn on the AC as cold as they possibly can, leaving their poor partners shivering in the corner. So night sweats, another symptom of menopause.
Urinary problems, very common symptom in perimenopausal and postmenopausal women. You call this urogenital atrophy, wherein the vaginal mucosa, the cells, are no longer moistened or lined by estrogen levels, and therefore can produce urinary symptoms like stress, urinary incontinence, where you're not able to hold your urine, or there is an overflow of urine, particularly at night. And this can actually be a trigger symptom of menopause.
And then we have mood changes, depression, irritability, and anxiety. Dr. Anbel has already addressed this a little bit in some of the other, she's talking about some of the other symptoms. But again, our hormones are our messengers. And so when we have changes in the messaging system in our body, it can change our moods, estrogen, an imbalance between estrogen and progesterone can cause some anxiety. As she mentioned, the heart palpitations, they oftentimes go together. Progesterone is known as the kind of a calming hormone, and when there's a decrease in the estrogen or the progesterone, then we may lose some of that natural calming that progesterone will give us and experience more irritability or depression.
Now, vaginal dryness and painful intercourse. Unfortunately, there is a vicious cycle of vaginal dryness that occur particularly in the late perimenopausal phase, or that late perimenopausal transition phase, wherein because of the depletion of your very good or producing ovaries of your egg cells, there's a depletion now of your estrogen. And remember that you need estrogen to line and moisten these vaginal cells. And therefore, if there's a depletion, there's vaginal dryness. And with the vaginal dryness, this can cause actually some form of dyspareunia or painful sexual intercourse. And when this happens, there's a decrease in your physical sexual activity, and it now forms a cycle wherein there is a loss of your libido. And Rachel will talk about this more intensively after I explain that the cause of your vaginal dryness, again, is because of your estrogen insufficiency overall in your vaginal mucosa.
So that will segue into the loss of sexual desire. So that comes from a couple of things. One, when you don't have enough estrogen and the vaginal tissues are dry, it's not pleasant to have sex. But we're also losing testosterone. And the loss of testosterone decreases our libido or our sexual desire. So this, again, is one of the underlying factors of the loss of sexual desire that occurs more commonly during
Weight gain. I'm sure a lot of you women out there are experiencing weight gain. Let me tell you this, before you even reach menopause, fat deposition is more into the hips, into the upper thigh, and into the buttocks. But once you reach menopause, unfortunately, fat distribution now is in the stomach and in the abdomen, and therefore increases that weight that you actually would like to shed off during menopause.
So we've talked about some of the more common symptoms of menopause. And as Dr. Enbo said, you might experience one or more of these, but not necessarily all of them. But it's not all doomed, okay? It's not like this is a terrible time in your life, because these things can be addressed. There's a couple of symptoms or conditions associated with menopause that may need a little bit more attention, and Dr. Enbo is going to address those at this point.
Okay, as I did mention that estrogen has actually two roles. It's a protective role. It has a protective role in the heart, and it also has a. It also reduces the risk of osteoporosis in the bone. So it focuses, especially in the postmenopausal women, your estrogen actually is protective to both bone and to health. Now, with regards to the vagina,
Yeah.
I would like to, you want me to talk about that? Okay. Okay. So apart from the heart and apart from the bone, what do we want to focus on? We want to focus on vaginal health, because that is the most neglected and least discussed amongst women. And we know that you women out there have experienced some form of vaginal dryness, vaginal looseness, recurrent vaginal infection, or even just simple stress urinary incontinence, where there is passage of urine upon laughing, sneezing, or just simply walking. Well, we have good news for you, because right now we have in our presence, in our country, we have Thermiva. Thermiva is a temperature-controlled radio frequency, the first non-invasive, non-surgical procedure that will restore vaginal health, particularly in women who have vaginal or vulvar dryness, looseness, and have any experience of stress urinary incontinence. And it addresses all these, apart from not only functional impairment, but also for aesthetic imperfections as a woman goes through the natural process of aging. What Thermiva does, it actually enhances the tightening and smoothing of the skin, because now it also stimulates new and more collagen. And because of these heat, or the science of heat, it actually massages around the labia and the clitoral area. It actually increases blood circulation. It now increases sensitivity, at the same time improves orgasmic activity. So apart from that, in the vagina, it not only thickens, but it also smoothens the mucosa, stimulating circulation, and therefore increases lubrication, secretion, and wetness.
So this is a fairly new procedure that's here in the Philippines. I come from America. We've done over 55,000 treatments in America. We've never had any complaints about it not working, and no adverse side effects from this. And it's completely painless. Can be done in the privacy of your doctor's office. Can be done on your lunch hour. There's no downtime. There's no restrictions whatsoever. You can resume normal activity, including sexual activity, immediately afterwards. So I would, encourage you to consult with your doctor, Dr. Anvil. I know she's an advocate of it and uses it very successfully in her practice. Maybe you want to talk a little bit about some of your patients?
Okay, let me just emphasize that Thermiva is one of the healthy, safe, effective solution to vaginal restoration, particularly in women who have intimate dysfunctions, preferably because of the natural process of aging. There's the sagging, looseness of the vagina and the vulvar structures. There is also the intimate dysfunction brought about by functional impairment, vaginal relaxation, particularly after childbirth or pregnancy. And it may address the aesthetic imperfections that are also seen by women who think they have to correct their self-perceived defects. Now, Thermiva, I've been using this for almost 2 years, and I have very good results. Now, my youngest patient is 29 years old. My oldest is 82. I have 3 segments of patients, 20 to 40, 40 to 60, and 60 and above. And they come to me because of different concerns, but relatively because of vulvar looseness, vaginal dryness, overall vulvar dryness, and stress urinary incontinence. And I would like to tell you that all these patients, particularly the extremes, they are very happy, because if a woman comes to me for vaginal dryness, there is a secondary effect of vaginal tightness. If a woman comes to me for atrophic vulvovaginal laxity or dryness because of menopause, there is an additional secondary benefit of Thermiva, wherein they can now control their urine. And for those who just want to come just to feel good about themselves, there is a secondary benefit of increased sexual orgasmic activity.
So Thermiva will address specifically, it's going to be addressing the concerns and issues related to the vagina. But there are other issues that are more systemic that we talked about earlier, like hot flashes and night sweats and irritability. Thermiva doesn't really address those. So some ways that you can address those, one of them is hormone replacement. This is kind of controversial. I am personally an advocate of hormone replacement. I've personally been on hormones myself about 15 years. And I just turned 68, so I think it's working pretty well. And I was using this in my practice with my patients back in California. There are bioidentical hormones, which are biologically the same as what your own body makes, which I think now is becoming more available here in the Philippines. So again, something good to discuss with your doctor. There's other forms of hormones, and you can apply them topically. You can take them orally. So there's different ways of being able to deliver the hormones into your system. Hormones are for some people, not for everybody. And again, that's a discussion that you definitely should have with your physician. But if a patient is well monitored, you get your regular breast checks, get your pap smear, get your blood levels checked, monitored regularly, they can actually be very safe and I think increase longevity and increase your health. And we might now want to talk a little bit about some other things that you can do to help with this change of moving into this change of your life where you are now in the perimenopausal, menopausal state. What other things can you do, overall lifestyle changes that you can make that will help to bring balance and longevity and happiness back to your life? So do you want to talk a little bit about that?
Okay.
Okay.
Definitely, you women out there who smoke, it's time to stop. Because studies have shown that women who smoke have an earlier onset of menopause. It is because the nicotine found in smoking actually activates the liver enzymes that metabolizes some form of enzyme that metabolizes the sexual hormones and therefore repletes and depletes this in your body. So my advice, our advice, is to stop smoking.
Absolutely. Another one I think that we can't stress enough is healthy diet. And I know you've all probably heard healthy diet and maybe you're kind of tired of it, but healthy, what food is, think of food as medicine and medicine as food. And so what you put into your body is so important in restoring and maintaining health and vitality. So one of the easiest things you can do without trying to get all bogged down in a diet, or should I do a keto diet, should I do a paleo diet, should I do this or should I do that,
Right.
is because it can be very confusing. I get confused and I have a background in nutrition. Is just to buy healthy whole foods, healthy vegetables, buy whole vegetables and fruits and whole grains and healthy meats, poultry and fish that's been not farmed, that's not been produced with a lot of chemicals, a lot of hormones. You can't go wrong with that. And the more organic you can get, and I think again in the Philippines, we're seeing more and more organic produce becoming available and more affordable. Or if you can grow your own garden, there's nothing wrong with that. Grow some of your own produce. That's awesome. I think that's great. And again, bypassing the processed foods and bypassing the sugars in the grocery store. They might be convenient, they might taste good, but they're not good for you.
I think the dictum here is you are what you eat.
Absolutely. You absolutely are. Right.
That's right.
Yes.
Okay, apart from that healthy diet that Rachel actually enumerated, supplement to this would be exercise regularly. The American Heart Association actually recommends 10,000 steps a day. Okay, and apart from this, if you can't do 10,000 steps a day, a 10-minute exercise every day or 30 minutes a week would be helpful. Remember, when you jump on that treadmill or walk, it actually increases your endorphins or serotonins that actually may affect your mood swings or actually can address your mood changes, but it also gives you a certain physical and mental high. So jump on those treadmills or walk the 10,000 steps. Okay, that's good for the heart too.
It's good for the heart, it's good for the brain, it's good for the soul, right? Exercise, yes. So moving on here, I want to talk about avoiding trigger foods. And trigger foods, and I'm going to kind of put that into the category of the processed foods too, because I think processed foods will be the more sugar and the more processed foods you have, the more likely they are to trigger hot flashes and definitely depression. because we know that sugar can actually drive depression. Trigger foods for some people that might be triggering hot flashes, caffeine, it definitely did for me, even though I really like a good cup of coffee. But and if I had caffeine anytime after 12, I couldn't sleep at night. So kind of knowing what works for you. Other people can drink coffee at 10 o'clock at night and fall asleep. I don't know how they do it, but they can. So find out what foods might trigger your hot flashes or your depression or your insomnia, and avoid those foods. So sometimes doing a diary and writing down your symptoms and writing down the foods that you had that triggered those can just be another way of sort of self-assessing how to manage your symptoms.
In addition to that, I think taking in some bioflavonoids,
yes,
that can actually help.
Do you want to describe to
these are actually more of the citrus, citrus foods that actually are the green leafy vegetables that actually can increase your or decrease the symptoms of your menopause. Even soy and tofu, this can actually decrease your the symptoms of hot flashes.
Because they have a lot of what we call phytoestrogens.
Yes, phytoestrogens, yes. In fact, there are women who are still in their perimenopausal phase, they're still menstruating, and yet they have the symptoms of hot flashes, where we know that hormonal replacement is still not for them. We can give them phytoestrogens. And these are just plant synthetic estrogens that can actually help and decreases the triggering points of menopause.
Exactly. So we talked about the trigger foods, maybe keeping a diary of your symptoms and what things trigger it. I think taking time for yourself, and I know that self-care can be a very challenging thing when we have so many things going on, and I find it. I want to walk the talk, but it's hard for me to sometimes. But sometimes I'll tell my partner, I said, I'm going upstairs, I close the door to the bedroom, and I take a hot bath. I said, don't bother me. It's like, this is my time, me time. And, or I'll get up early in the morning when it's all quiet and just have 10 minutes or 20 minutes to myself. So finding some ways that nourish your soul and nourish yourself. However that is, it might be a walk at night, it might just be some alone time with the door closed, it might be a one-on-one time with a woman friend. Whatever nourishes your soul is another way of really nourishing yourself.
I think that is very important, because it's important to have some form of self-introspection when you just want to have that me time, because it brings you back to how else you can actually make yourself feel better, right?
Yes, right. So then one more thing I want to talk about, and then Dr. Anbo will end it, is learning something new. And we know there's many studies that indicate that if you take on a new hobby or a new task that stimulates the brain, it widens your world. And like I said, I just moved over here 8 months ago. My world is being opened up in a whole new way, and I feel actually more vital and more energized than I have in a long time, even with all the travel that I do. So learning something new, a new language, a new game, dancing, I just read the other day, is one of the best ways to stimulate the brain and keep dementia and Alzheimer's at bay. So learn something new and make it fun. It doesn't have to be hard work. It should be something fun and something that you enjoy.
Write a book.
Write a book, right?
Write about yourself, your autobiography.
Exactly.
Yeah. Or start a painting session, or whatever.
Absolutely.
Yes. So we're actually telling you, viewers out there, how it is to feel good, how it feels to, feel empowered. And therefore, it is important that not only do we think about ourselves, we also need to remember that in life, to enjoy life, there is also this partnership that we may have. And how do we go about this? Is to enjoy life with them, physical activity, emotional upliftment, not necessarily going to sexual or intimate activity, but yet that is still an important factor in enjoying life. So we'd like to let you know that women wellness is part and parcel of a woman's feminine sexual well-being. So we have actually discussed that it not only involves a good physical but mental health, but together with a sound mind and body, a woman's soul and spirit, as Rachel has emphasized, are revitalized and empowered.
Yes. So during this time of menopause, and you can actually kind of see it as a time to take pause. It's the same worldwide. Women in the West, women in Asia, all over the world. This is a time to kind of define who you are. And with the culture always, regardless of where I am, the culture is always emphasizing youth. But to me, I think there's nothing more revitalizing, more stimulating, more sexy than a woman who owns her own power, who owns her own femininity, and embraces who she is right now in this time, in this phase of her life. And it's a continually evolving process. So power to you, and we encourage you to take what we shared with you today. And Dr. Annabelle, it's been a pleasure to work with you. And
It was even my pleasure too. Thank you.
You're welcome.
And so, viewers out there, we hope that you have enjoyed the small tete-a-tete, intimate talk on menopause. And therefore, we hope to see you in the next episode of Let's Talk V, or Talk with Doc series. So goodbye and take care.
Bye.
Stay well.